Welcome back to part 2 of chapter 18, Assisting in Pediatrics. So let's talk about postpartum depression. An estimated 10 to 20% of women struggle with major depression before, during, and after the delivery of a baby. And fewer than half of the 10 to 20% of women who struggle with this depression are diagnosed in routine office visits. So it's important that PPD be detected, postpartum depression, as soon as possible so that we can begin the treatment with the mother. So risk factors of postpartum depression include history of depression, abuse, or mental illness, smoking or alcohol use, anxiety during pregnancy and fears over childcare, lack of financial resources and secure relationships, if the baby is fussy or a colicky infant, and lack of social support. Colic. So what is colic? This is seen in the newborn period or in early infancy. An infant between 2 weeks and 4 months of age who is crying and has crying episodes that occur at least 3 times a week for longer than 3 hours a day and lasting 3 weeks would be put into this category of a baby with colic. A child frequently outgrows the condition before the cause can actually be identified because they start to look at multiple possibilities. So frequently, by the time they actually diagnose the colic, the child or the baby has outgrown it. Drugs are not helpful with colic and in some cases may actually be dangerous to the infant. Parents need a lot of reassurance that they are not responsible for the child's discomfort, and they may find counseling and assistance in developing coping techniques helpful. It can be. I don't know if you've ever dealt with a colicky baby, but it can be heartbreaking because you do feel like, why can't I help and what's going on? Let's now discuss diarrhea in infants and small children. Diarrhea can be caused by many microorganisms like bacteria, viruses, and parasites. It can be caused by food allergies or certain medications like antibiotics. It's diagnosed when the child has 2 or more watery or abnormal stools within 24 hours. So I'll say that again, diarrhea is diagnosed when the child has 2 or more watery or abnormal stools within 24 hours. Prolonged diarrhea can lead to dehydration and electrolyte imbalance. And I believe in our pharmacology lecture last week, we talked about that diarrhea can be much more dangerous in an infant or small child. We need to look at dehydration. So signs of dehydration, lack of tears when crying, lethargy, fewer wet diapers, decreased urination, dry mouth and lips, and weight loss. Infants and small children should be followed up by telephone in 12 hours and then daily until the diarrhea has stopped after they've made a visit to the physician. If the infant is being breastfed, the baby should continue to nurse, and formula feeding also should be continued. Let's look now at failure to thrive. Failure to thrive is when an infant or young child whose weight is consistently below the 3rd percentile on the standardized growth charts, or one who is 20% below ideal body weight for length when we're comparing weight to length. We also, with failure to thrive, physical, mental, social skills are delayed. If there's failure to roll over, failure to smile, coo, stand, or walk at age-appropriate developmental levels. And this is caused by physiological factors or a problem with the parent-child relationship typically. Children with failure to thrive need more calories than usual, so approximately 100 50% of their normal calorie load to catch up to their target weight. Experts believe that infants may experience this problem if they are being neglected. However, low weight gains also are possible with extremely attentive and cautious parents, so we can't make this a judgment. But they do find that with infants that may be neglected, that they also see this, but it does not mean that failure to thrive means they are being neglected, if that makes sense. Obesity in children. So a child is considered overweight if their BMI for age is between the 85th and 94th percentiles. The child is identified as obese if BMI is at or greater than the 95th percentile. Reasons for obesity can include family history, inactivity, high calorie diets, which we see so often, especially with fast food diets, stress, and rarely there can be a metabolic or endocrine disorder. It's important to provide educational materials and encouragement for children and parents, and referral to support programs in the community. The psychosocial impact of obesity can be overwhelming for many children because isolation, loneliness, and lack of self-esteem are common with obesity in children. Overweight and obese children are at a greater risk of developing serious health conditions. These conditions include asthma, diabetes type 2, sleep apnea, and it also can increase the risk of cardiovascular disease and hypertension. The common cold or rhinitis has more than 100 causative pathogens and is highly contagious. Signs include nasal congestion, low-grade fever, general malaise. The parent may need to be shown how to use a nasal bulb syringe to suction the nose for an infant. You know, those little blue, typically they're blue or greenish. You suck in, push in to suck out the air, put it gently into the nose, release it, and that can clear out the nasal area in an infant. Secondary infections in the lower respiratory tract or in the middle ear can occur with the common cold. How is the common cold spread? So it's spread through the respiratory droplets from rhinitis, sneezing, or coughing, either from direct contact or from touching contaminated items. So we talked about this in the very beginning of class where I touched everything and it was infected, and then somebody else comes up and touches the doorknob or the desk or the book or the pen or the pencil, and that is contaminated and it can spread. Most colds are self-limiting and run their course in about 7 days, 5 to 7 days. Some of those common secondary infections that we spoke of in the last slide might be strep throat. Strep throat causes a severe sore throat, fever, headache, and lymphadenopathy. If not treated with antibiotics, it can lead to scarlet or rheumatic fever. So strep throat is one of those things that we definitely need to get antibiotics on board with the patient. Scarlet fever causes a bright red, rough rash over child's body. And rheumatic fever is a serious disease that can damage heart valves. Strep is easily spread when an infected person coughs or sneezes, contaminated droplets into the air, and another person inhales them. A person also can become infected by touching such secretions and then touching the mouth or the nose. It is highly contagious. Otitis media. So this is figure 18.4 from your book. Here on the left, this shows serous otitis media, and over here on the right is demonstrating suppurative otitis media. Signs include inflammation of the middle ear with fluid building up behind the tympanic membrane. Traditionally, children with indications of middle ear infection were treated with antibiotics. However, if the infection is caused by a virus, we know that antibiotics will not help. Now, if the fluid in the middle ear persists for longer than 3 months, and or if the child experiences hearing loss, the physician may recommend a laryngotomy. In this operation, a small incision is made in the tympanic membrane and a tube is inserted to drain the fluid and balance the pressure between the outer and middle ear. So you've probably either yourself had them or know somebody who has had tubes before, and that is this procedure. It's important to note that over-the-counter cough and cold products should not be given to children younger than 2 years of age. The FDA is also concerned about the use of these products in children ages 2 to 11. Complications may occur, including but not limited to death, convulsions, rapid heart rate, and diminished level of consciousness. So we want to educate our parents on the fact that the over-the-counter cough and cold products should not be given to children younger than 2 years of age. Giving a child more than one product that contains the same active ingredient can result in an overdose in a child. Croup. Have you or anybody you know experienced a croupy baby? It's really sad. So this is a viral inflammation of the larynx and trachea that causes an edema and spasms of the vocal cord. They have hoarseness, a harsh barking cough, and stridor during inhalation. So you hear the sounds, and really that barky cough is so dry, it sounds almost like a seal. Infections usually is self-limiting, and the child typically recovers without treatment. We recommend use of cool mist humidifiers and to sit in a steamy bathroom or take the child out into cool air, because these all help with that inflammation of the larynx. Pertussis or whooping cough. This is very contagious respiratory illness caused by bacteria that attach to the cilia, can cause violent and rapid coughing. A recommended pertussis vaccine for infants and children is the DTaP. Complete vaccination requires 5 doses starting at 2 months of age and up through 4 to 6 years of age. When you get this 10 years after your 4 to 6 years of age, it changes to Tdap. Bronchiolitis is a viral infection of the small bronchi and the bronchioles. Usually it affects children younger than 3 years old, varies in severity, and is seen in children with a family history of asthma and exposed to cigarette smoke. So we see this more commonly if there is cigarette smoke at home. Inflammation, edema, increased secretions, and bronchospasms in respiratory pathway. The treatment includes acetaminophen and a bronchodilator inhaler or nebulizer treatment. Most children fully recover from this in about 2 weeks, but as many as 50% have recurrent wheezing and coughing. RSV infects the lungs and the bronchioles, can cause a serious respiratory infection in infants and older adults, and most common cause of bronchiolitis and pneumonia in children younger than 1 year of age. So if they have this virus, it is linked to the most common cause of the bronchiolitis and pneumonia. Symptoms start out similar to the common cold, and researchers are currently working to develop a vaccine for RSV. Asthma. Asthma is the most common chronic health problem among children. This is triggered by many factors. What do you think some of the factors are?